Our next panelist will be Dr. Paul Saunders, who is an expert both on herbs and homeopathy. He has his PhD in plant ecology from Duke, and then has multiple qualifications in both the field of naturopathy and homeopathy, and is a professor at Phytolacca.
Okay, good evening. So I was asked by Dr. Boone to talk to you, can everybody hear me all right? To talk to you about herbs and homeopathy, and I'm doing it from the standpoint of what is the evidence there. I'm not doing it from the standpoint of what I do with patients, which may or may not be the same thing, depending on what we're talking about. So I'm just going to preface that a little bit. So I want to talk a little bit, and Dr. Mason has done, Burford Mason has done this a little bit, about what the common cold is. And again, I did a trial of this once, and so the issue is really it's based on symptoms because we never really do nasal swabs and test what they are. So for example, the common cold has a variety of names, as you can see. Acute coryza is hardly ever used anymore, but it sounds pretty interesting. So, you know, symptoms such as fatigue, chills, headaches, which often lead to cough in about 50% of individuals, sore throats in about 40%, nasal discharge, and a low-grade fever, which is much more common in children. You usually don't see that in adults clinically. Symptoms usually take about 16 hours after exposure to develop. They peak at about 2 to 4 days. They resolve in 7 to 10 days. You know, the thing is, do you take something? Do you wait 7 to 10 days? That sort of thing. And occasionally go on for 3 weeks. That's somebody who really needs some support, as Dr. Burford Mason was talking about. Children are much more prone to coughs than adults. Although I would say this summer I've seen more, I can't say which virus it is because I've never measured it, but I've seen more respiratory infections ending with coughs that persist than I've seen in all my years of practice. So quite an interesting shift this summer. And the cold, which one causes it? There are over 200 viruses implicated, and most people have more than one at a time. So what are we dealing with? Basically, we're dealing with symptoms that produce the #1 infection. Colds, you know, here's what they say are the average numbers, so look at this and see how you fit. Or do you get, as an adult, 2 to 5 a year, losing 2 days of work, 2 days of work a year? Or if you're a child, 6 to 10 a year, or if you're in the younger grades or preschool, as much as 12 a year. And then they say it gets more older as you get more frequent as you get older because your immunity decreases. Maybe that's me, I'm sort of getting over that now. The other subject that we're looking at is influenza, which has had a variety of names: la grippe, catarrh, sweating sickness, or influenza, or the flu. The symptoms are similar, but there are some differences. We have chills, fevers, sore throats, sweats, that's why it was called the sweating sickness, muscle pains, nausea, vomiting, and the infection can go on for 1 to 7 days, or an infective period of 1 to 7 days there. There are seasonal epidemics associated with flu, and that's what many people think about. The flu is a sort of an epidemic thing. And it's estimated that worldwide 3 to 5 million people per year will contract these, with about 500,000 deaths a year. So the cold is not really, quote, known to kill anybody, but the flu can and does. Now, there are 3 types of flus from the standpoint of, you know, if you're analyzing them and looking at symptoms. There are type A, type B, and type C. So we'll do A first, which are typically, we think now, go from aquatic birds into domestic poultry and into humans. These have rapid mutation. They can change very rapidly. They can produce pandemics, and the most famous was probably within, not my lifetime, or yours, but was the 1918-1920 pandemic, which killed millions of people. There was a lesser one in 1957. I survived that. There was another in 1968, which I also survived. And these are, so I'm still here. And these are typically designated as H and a number, and N as a number. So if you've heard H1N1, H3N1, H3N2, whatever, these are how they're designated. These are the ones that epidemiologists and the World Health Organization get all excited about. The ones that's much more common are the influenza B. This is sort of the seasonal flu that comes around every year, that government agencies try to figure out what it's going to be and make sure that you get vaccinated for it, and not always is there a match there. And I'm not going to go into that, but that's what happens there. These are found in humans, seals, ferrets, so watch your pet ferret if you have one, And these mutate at anywhere from half to 1/3 the rate of influenza A. So they will mutate, but they do not mutate rapidly. And that's why they're not, they cause lots of illness and sickness, they will cause some death, but they do not cause death at the rate of an influenza A. And then finally, and this is sort of new stuff. When I went to medical school, there was not influenza C, it was A or B. So now we have C. It's found in humans, but not very commonly. It's found in dogs and pigs, and these produce just local epidemics. They usually don't have the ability to spread beyond the local area. So it might just be the Toronto epidemic, if you will, or the Dundas epidemic, or something like that. They're usually, they're not as common, and they're generally mild in children, but more significant in older individuals. We often think of colds as everybody gets a cold. Flus are more significant in older individuals, but in the pandemics, it's often the young and the sort of the early adolescent, early adults who are most affected, and in these others, it's more the older population that's affected. So different influenzas affect different segments of the population typically. So let's talk about herbs. Now, the herbs we're going to talk about, I'm going to talk about several different species of different herbs and prepared differently and used in different ways. And so what I tried to do, I couldn't always get a cold, so some of these are going to go, well, that's not quite a cold. But it's as close as I could get from something. So these are some traditional Chinese medicines for medicines and combinations for sore throats. This involves 12 trials with about 1,900 patients over the 12 trials. And they looked at 6 different formulas, which in the way they analyzed said that it was better than the controls that they used in these patients. The problem with this, according to the Cochrane database system, when they looked at this, was lots of methodological issues, how the controls were done, standardization of the herbs and so forth, but this would suggest that perhaps some of the TCM patents may have some benefit for sore throats. This was a study that was looked at aromatic herbs. This was a combination of aromatic herbs. 60 people in this trial, 26 in the treatment, 34 in the control, and it was prepared as a spray. And so individuals took this spray, 5 times a day for 3 days. That was their treatment for their cold. And what we saw was a significant improvement at 20 minutes after treatment, which was statistically significant, but no change in symptom severity after 3 days. So there was no real change. There was a little bit of improvement, but no real change in severity of symptoms. This aromatic formula consisted of eucalyptus, 2 species, Citrodora and globulus, as well as Mentha peperita, which is peppermint, Oreganum syricum, which is oregano, and Rosmarinus officinalis. So these were used as essential oils, and it was theorized that they had an anti-inflammatory and analgesic effect, which these essential oils do. And I would also add that a number of these essential oils have been shown to have antimicrobial effects as well. So perhaps spraying them into the oral cavity would help to reduce the activity of those viruses that were present. Echinacea is, of course, something I'm sure all of you have heard about, and I have to, right up front that I was involved in a trial with this for children some years ago. So this is a very common native North American plant that has been looked a lot. And so looking at trials up to 1999, there were 19 treatment trials, 8 of which were positive, and 4 prevention trials, so trying to prevent infections, of which 3 had marginal benefit. The issues that I find when we combine these trials together, we look at echinacea, is different preparation. How is the echinacea extracted? Which species are we using? There are 3 different main species of echinacea. Echinacea angustifolia, Echinacea purpurea, and Echinacea pallida. And they do have slightly different constituents and different properties. And then the other issue is that sometimes these are combination formulas or combination extracts. So we have echinacea being looked at, but we have, across the 9 trials, we almost have 9 different forms of echinacea being examined here. And then the other issue I find with echinacea is the dosing. What is the proper dose to use with echinacea? So, this is another one looking at echinacea for the common cold, again up to 1999. In this group, they looked at 12 trials which were positive for treating the common cold. Prevention trials, no effect. So in other words, people took echinacea, but it didn't change the incidence of colds in this population. However, there was some reduction in severity, duration, and frequency, but it was not statistically significant. So some improvement, but not statistically significant. They concluded from this analysis that it was safe to use. And again, the issues were very small trials for a lot of these. For example, the trial was involved in was less than 20 individuals, 20 children. And the issue again is the dosing. Not all the doses were standardized, they're prepared in different ways. And so with a plant like this that contains lots of different constituents, you're going to extract different things, whether you use alcohol, water, and what your percentage of water and alcohol will be, for example. Whether you use the seed, whether you use the root, whether you use the leaf, again, all of these things will affect outcomes. This was a meta-analysis looking at Echinacea and the rhinovirus, so this is looking at it with respect to colds. And in this meta-analysis, they were pretty brutal. You can see they looked at 234 articles and they only accepted 3. And the reason they did was in this trial, and see if you'd sign up for this, was they induced the cold. They took somebody or a virus that was live and they gave you a nose swab and an oral swab so that you would get a cold. So this way we knew you had a cold and we could check your symptoms. So significantly they found a reduction in cold risk versus placebo, which was higher than placebo versus Echinacea, so actually Echinacea didn't work. The difference was significant, and standardized had very little effect in preventing after inoculation. In another analysis looking at Echinacea for infections, these are some of the compounds that are found in Echinacea. We have caffeic acids, we have polysaccharides, and there are a variety of polysaccharides. Polysaccharides are interesting because these are plant compounds that can modulate or influence our immune system in very positive ways. But different species will have different amounts and different compounds. We have alkamides, which some manufacturers are focused on, and as a single activity, not very effective in this article by Hudson. But he pointed out that when more of the plant is there, we have more of the constituents present, the activity is actually more effective. So for example, Echinacea has been shown to be effective against herpes simplex virus 1, the respiratory syncytial virus, which can cause colds, influenzas A and B, the rhinovirus, which can also cause colds, feline virus, this is for your cat, and Tamiflu-resistant influenza A. Tamiflu is one of the drugs that would be used to treat influenza A if it came around. So at least in a petri dish setting, or working with the viruses, Echinacea will have some activity against these viruses. The other thing that's interesting about Echinacea, which is important, is that it will reduce or reverse these cytokines, interleukin 1, 6, 8, and tumor necrosis factor alpha. These are the things that, as Dr. Perfect Mason was talking about, will produce those secondary symptoms, the cough, the fatigue, the sore throat, and all those sort of things. It reduces or reverses some of those, and it also reduces mucin secretion, and I think you all know what that is. Echinacea has also been shown to kill strep A, Haemophilus influenzae, and Legionella bacteria, but it will not kill methicillin-resistant staph A, Klebsiella pneumonia, which is very common in children, and Mycobacterium smegedum is one of the 200 different species of mycobacterium infections. So Echinacea has immune modulation effects which are both direct and indirect, and it works on some species and it doesn't work on other species. So it's important from a clinical standpoint to know what you're treating, or from a research trial standpoint to know what you're treating. Now, Sambucus nigra, I'm sure some of you have heard of this, as an herb for use in influenza B, or use for influenza. So this was a study done on Panama 1993 virus, influenza B. It was done on a kibbutz in Israel. It was double-blind, placebo-controlled, and they used a standardized extract. Okay, so we've got a substance, we know what it is, and we've got this particular virus for testing. So what they actually did was, what's unique about this trial, and you haven't seen in the others, is they actually tested for the presence of this virus. And they looked to see what was present. Influenza A, B, RSV, adenovirus, or the Panama B 1993. So there was a significant change in fevers, 93% versus 91% at 2 days versus 6 days in the placebo. So the Sambucus was definitely much more effective here. And what they defined as cure, which is basically the absence of major symptoms, was 90% in the treatment group. That's 2 days versus, I don't have the percent, but it took over 6 days in the placebo group. So highly significant, this particular extract. And no side effects. It was actually a fairly safe compound. This was used in adults and children. This is another study with Sambucus, a similar thing. This time it was looked at during the 1999-2000 influenza season in Norway. 60 individuals aged 18 to 54. It was double-blind placebo control, and they had to have symptoms for less than 48 hours. So basically, they were told they got a flu, A or B. They called them up, and then they were either given the active ingredient or they were given the placebo, and they didn't know which. They gave it to them as a syrup. So they got 15 mils of this syrup or placebo, and they took this 4 times a day for 5 days. And what we found here was symptom relief at 4 days earlier than the placebo, and the use of rescue medicine was less in the treatment group than the placebo. So people weren't going to aspirin or Tylenol or whatever their favorite other thing was when they were using this particular substance. So this particular appeared to be active, at least in this particular setting. Then there's Panax quinquefolium. Panax quinquefolium is the North American ginseng, which is much more highly prized in the Orient than it is in North America. So we grow it here, not too far from where I actually live, by Brantford, and we ship most of it to the Far East. Very little stays in Canada. Okay, so this is a study that's been done on this. It was done in seniors, and you can see at the bottom, it's basically the cold FX preparation. So this was one of their early studies on individuals over 65. They had already been immunized, and they got 200 milligrams twice a day versus placebo for 4 months. And what they looked at was acute respiratory illnesses in this population. And so what they found was that there was nothing significant in the first 2 months of their using it. It was only in the last 2 months that there was less respiratory infections, 32% in the treatment versus 62% in the placebo in the second half. So it had some effect, but it's not right away. You've got to take it for a while to get some results. The duration of symptoms was 5.6 days in the treatment versus 12.6 in the treatment in the placebo. So that's quite a bit of difference. And so what they showed was that there was reduced risk. It was safe in daily use. And what they were using was a polyphyranosol pyranosol saccharides, just a particular extract from this Panax ginseng. Another one using Panax, this cold FX preparation, which by the way is a Canadian product developed through the University of Calgary, or some faculty involved with that. And this was children ages 3 to 12, 75 of them, 46 developed infections, and they were assigned either to the standard treatment, 3 times a day, or based on weight and age, low dose or high dose. So they either got 45 kilograms was the cutoff. And other medications were allowed, but were recorded. Okay, so they could have rescue medication, but they had to record what they were using. So there was no significant difference in the treatments and placebos, but subjects in the standard dose were actually sicker on entry, which is kind of interesting. So they weren't quite equal when they came in. Sicker ones were in the treatment group. No significant adverse effects. And the confounding factor in this trial is they got to use OTC and prescription medications. So they got the cold FX, but they were also using other things. So it really made it difficult to show. I think the outcome was the product was safe, but it really didn't have much significant effect. And then they did another study. This is the other study with cold FX in athletes. And the issue is, they were encouraging people to take it. So athletes, you know, performance is important. If you're doing an endurance sport, your secretory immunoglobulins A are going to be reduced, and you're much more susceptible to respiratory infections. So the question is, will it fall under the IOC guidelines? You can't have Panax if you're meeting those guidelines. So what they did was they had some high-trained athletes. They took 400 milligrams a day for 28 days, so basically a month. They did urine tests, which is the way IOC tests for things, and nothing came out. The athletes were taking advanced substance, that's good. And the Panax ginseng didn't come out as an issue, and so that's good. So cold FX, if you want to take it and you're a high-level athlete, it does not violate the IOC rules. It doesn't bring through, and that's because they're actually not using the compound that the IOC is interested in anyway. That's part of it. But this sort of proves that. Then this is a study looking at Panax ginseng and influenza viruses, and so this is mice with the polysaccharides, so it's not humans, so this is for your pet mouse. And they gave them H1N1, H3N2, so these are both influenza A, right, versus placebo. And with the H1N1, there was enhanced survival, moderate enhanced survival, and lower lung viral titers. So what they actually do was measure the amount of viruses in the mice lungs. We don't really do that in humans, okay? And they look at their interleukin-6, which is an inflammatory cytokine. In the H3N2 group of mice, there was enhanced survival and again, lower lung titers. So this suggests that at least in mice, I won't say it's in humans, it's in mice, that Panax ginseng, this particular extract, would enhance survival of your mouse if they got H1N1 or if they got H3N2. So this is a good thing. Now this is Panax ginseng. So this is the Asian species of ginseng. Then this is Panax ginseng for COPD, chronic obstructive pulmonary disease. These are 12 studies, so this is a meta-analysis looking at 12 studies, 1,500 subjects, 11 were accepted. There was a significant improvement in forced expiry ventilation 1, which means how much air can you blow out in 1 second. And there was a significant improvement in quality of life in St. George's Respiratory Questionnaire Index. No adverse events, and patients on COPD were stable. So Panax looked to be okay in that condition. Andrographis paniculata is a TCM, or a traditional Chinese medicine herb, and Eleutherococcus senicosus is actually related to ginseng. Some people call it Siberian ginseng. And this was actually made famous by a lot of research done in Russia and was used by the Olympic athletes until, of course, the IOC started measuring these things. So this study was done in Volgograd on 500 individuals, and what they gave them was this extract known as ginseng, which contains Andrographis and Eleutherococcus. And they compared that to amantadine, which is one of the standard antiviral medications. They were randomized, and what they showed was that the individuals on Camgene recovered quicker and had less post-influenza complications. Common influenza complications, particularly for influenza A, are pneumonia, one of the very common complications for that, and bronchitis. So it was well tolerated, and some of you may have heard of this. There's also another preparation known as Canjane Plus, which contains Sambucus, so we have 3 herbs in that, but I could find no trials on Canjane Plus. And then, so why did they pick Eleutherococcus? It's related to ginseng, but it's not Panax ginseng. Well, what we've again showed, looking at sort of animal studies in Petri dish, is that Eleutherococcus has significant inhibition on RNA viruses, on human rhinoviruses, on respiratory syncytial viruses, the influenza A virus. And what it does is it prevents the virus from being absorbed into the body, into cells, and replicating. But it has no effect on DNA viruses. Now, I didn't really go through this, and I won't do it here, but basically there are RNA viruses and DNA viruses, the way to think of it. So, no effect on DNA viruses such as ENO5, herpes simplex 1. So now you can get a sense of why Eleuthero might be in that formula. In plant screenings versus H1N1, when a few years ago we were looking for plants that were effective, we found significant effect at greater than 50% reduction using Andrographis, was the best. In the second category, we have Glycyrrhiza urolensis, which is a type of licorice, and Forsythia. Everybody knows what Forsythia is, right? It comes out yellow in the spring. Particular species of it. And then in the third category, Stobulanthes, Fuchsia, and Legustica. No effect on H1N1 with Astragalus, Heterozyme lonicera, which is often used in some cough formulas, and Isatis, which is also used in TCM cough formulas. Now, Eupatorium is a plant native to North America. It was used by the Native Americans, it was used by the eclectics, it was used in the 1918-1920 epidemic, and so it has really not been studied. This is about all I could find on this plant. It's a fascinating plant, and it's also used homeopathically, but I'm not supposed to talk about that at the moment. So anyway, it was used for viruses, and was used by the Native Americans for flu viruses. It's been used in Europe, and the extract has been shown to have anti-inflammatory, anti-plasmodium, which is malaria parasite, and immune-modulating data on cold. But there have really been no studies of it on viruses in the present day, which unfortunately, I think this is a plant worth looking at. And kiwi gold fruit and respiratory infections. This was 32 individuals over 65. So they were given this combination of gold fruit, kiwi gold fruit, or bananas for 4 weeks in the washout, and they flipped over and they got the other. And they used the Wisconsin Upper Respiratory Symptom Survey, which was what was used in some of the Echinacea trials for 21 days. And they looked at blood values and so forth. And what was significant was a change in duration and severity of congestion and sore throats. There was increase in plasma vitamin C because they were taking some vitamin C through these. And alpha-tocopherol, lutein, and zeaxanthin. These are compounds found in these plants. And RBC folate and reduced lipid peroxidation is what they found. But no significant difference between gold fruit and banana for the overall incidence of upper respiratory infections. No difference. You like gold fruit, you like banana, that's your choice. Now, the kiwi gold fruit enhances the factors to reduce severity and duration of the respiratory infections, but not a significant effect on the overall incidence. Garlic. Everybody knows what garlic is? How many of you like garlic? All right, good. Okay, so this is Allium sativa and using the allicin extract. That's what gives garlic that zip that you all like, right? Dragon breath, right? Keeps the vampires away, trolls away. So in this trial, 146 individuals, they gave them 180 grams of allicin versus placebo for 12 weeks throughout the winter. Can you imagine that? Just imagine that. Just as an example, I put down there at the bottom, in the average clove, you get 5 to 9 milligrams. So you can think of this as a super dose of garlic. This is a lot of garlic. So significantly fewer colds, significantly shorter duration, 1 versus 5 days, and significant reduction in the number of colds. But remember, they took it every day for 12 weeks. Okay? That's a serious Caesar salad hammer, right? This is aged garlic with the cold and flu. 120 individuals, double-blind, placebo-controlled, so they didn't know what they were getting. They got 2.5 grams per day. What was that in the previous study? 180 milligrams. Now we're going serious. 2.5 grams per day for 45 days. Significant effect on natural killer cell activity, significant effect on T cell proliferation, but no significant effect on reduction in cold and flus. Have we overdone it? Well, we have to wonder. 180 versus 2.5 in the amount that was taken. There was a reduction in severity. That was significant. There were fewer days, and days missed fewer were better in this group. So that's clearly the benefit there. A little reduction in symptoms and less time away from work. In this particular study, this is kind of interesting. This is a case study. This is an N of 1. This was a Turkish child who was very critically ill and had a resistant bacteremia. They tried all these antibiotics in this hospital in this child, and none of them responded to the infection that this child had. So this child was about to die potentially. So they took the bacteria that was in this child, they tested it on a disc using a garlic, and they found that the garlic worked on it. So they gave the child the garlic and the antibiotic. The child recovered, and they published this as the first case of garlic and antibiotic surviving child in the medical literature. So this was published in 2011. Phytolacca is another Native American herb which is really very poorly studied as a treatment for infections, but it used a lot in research on viruses. Fascinating herb. It has anti-HIV, influenza, and other viruses, so it actually is very effective against viruses. What's interesting about it is it does not cause cell death where the viruses are situated, and it inactivates the viruses by a very different mechanism, which these authors suggested in this recent publication should be studied as another mechanism for developing drugs to address colds and flus. And then this is a combination formula used against the common cold. It contained Echinacea, garlic powder, Nigella, which is a particular herb, and panax, with a little vitamin C and a little zinc compared to placebo, and they took this for 14 days. So they looked at time to symptom resolution in the individuals who had this formula versus the placebo, and they found that 4 days on average to symptom resolution with a range of 3 to 6 versus 8 days with a range of 5 to 9 in the placebo group. So that's a pretty significant reduction, as you can see there. And they found also that symptoms were greatly reduced at 4 and 8 days in the particular study. The other thing, it's not quite a point, but it's close. So probiotics. I thought this was kind of interesting because it's a Canadian study. It was done in London. So this is looking at individuals who are living with a virus. Okay? And so what they're looking at is what happens to their viral counts when they take this particular substance, which is a probiotic. So we got some organisms there. And these were 21 individuals on the highly active antiretroviral therapy. They were given a yogurt treatment Yogurt A had nutrients and probiotics in it, B had micronutrients, and C just the probiotic. They did this for 30, each for 30 days, 14 days of washout in between, and it was double blind in this particular study. So what they saw was a significant change in their CD4 counts. In B, there was an improvement by 41, so that's the group that got just the micronutrient. In A, there was an improvement of 19, which was the micronutrient plus the probiotic. And in C, which was only the probiotic, there was a decrease, that's not good, by 7. Everybody felt there was a significant increase in energy and performance of daily tasks in all the groups, so we had a nice placebo effect, and no adverse events. So these are people living with a virus and looking at what might potentially be useful for them. Now, homeopathy. Homeopathy uses minute preparations of plant and animal or mineral materials. And this was a study that was actually just discussed earlier this afternoon. This was a study done in Austria, and published in Chest, which is a very reputable journal. And they used homeopathic Calibic 30C, and these were individuals who had severe lung secretions. These were patients who were intubated and had to have the secretions sucked out in order for them to live. They all had a history of smoking. Okay? It was double-blind, placebo-controlled. They took 30C twice a day for 2 days. And what was shown, what they measured was the tracheal secretions, the time that was before they could get the tube out, and the length of time in the ICU. There was a significant reduction in tracheal secretions, significant reduction in time to extubation, and a significant reduction in length of stay in hospital. Now that study was attempted to be treated at Sunnybrook just a few years ago, but was a different group of population, and so it had to be discontinued and never really got completed. Complex homeopathy in common cold. This is a preparation by Heal that was used in 85 practices in Germany. And what they looked at it was versus OTC or antibiotic use. They evaluated a number of symptoms, and they showed that the homeopathic versus the over-the-counter reduction in symptoms, which was significant, 71% versus 61%, and that was actually significant. This was another homeopathic preparation, another complex preparation on enveloped and non-enveloped RNA and DNA viruses that I was talking about earlier. The controls were some of the medications that are used for treating influenza, and they found significant effect on HSV1, adenovirus C, influenza A, RSV, parainfluenza 3, rhinovirus B, and human Coxsackie virus A9. The mechanism was unclear how these work, but this complex homeopathy at least appeared to have some effect on viruses. So this would suggest that this is something that could be looked at further in the human population. And oscillococcinum. How many of you have ever taken oscillococcinum or heard of it? You know, this is the homeopathic preparation of foie gras and heart from a goose that's been infected with the virus. It's a 200 seed preparation, so there's nothing there, no foie gras. So the vegetarians will enjoy it. 7 trials, 3 prevention and 4 treatment, 2,200 individuals. In the Cochrane analysis, no significant effect on preparation of the collusion, and no significant effect on reduction of illness, only 0.28 days. So they said the data do not support oscillococcinum as a first-line treatment of influenza, but it may shorten the illness caused by influenza. So, in an article published just a few years ago by a naturopathic colleague and some of his friends, they looked at the issue in the influenza trials was the size. Some of the trials are too small to really be effective. What's a problem with the trials that we do is we actually don't confirm, compared to most of the conventional trials, what is the organism that's being treated. So is it a flu virus? Is it a cold virus? And that sort of thing. And some of the outcome measures need to be looked at. So we need to sort of improve our trial designs in this regard if we're going to get better results. So what I've put here at the end are just a few trials, looking at some summaries, and you can see that overall the issues in homeopathic trials deal with allocation, with dropout, withdrawal, and concealment, and again, larger trials need to be done, and they need to be done better. And so in a variety of, this is another meta-analysis on 110 trials, and again the issue becomes, how is the trial to be designed to be effective, and how can we make conclusions? And this one was particularly interesting, this recent thing, was they said until the mechanism is worked out in homeopathy, there is such bias that the plausibility of something that seems like placebo working is probably not going to work. So what they're suggesting is that there's really a publication and an inherent bias against the use of homeopathy in some of these trials just because of that. Now, this is a trial that's proposed. They're going to be using Highlands cold and flu. It's a liquid format, 5 mils, 6 times a day or 4 times, or every 4 hours, depending on the particular patient. It's going to be placebo-controlled, double-blind, and they're going to look at treatments and so forth. And the trial is actually partly in process. It's supposed to be ended sometime later this year. And then what they'll do is they'll rank the symptoms for 10 days. So hopefully, in another year or so, this will be published, and we'll know whether this particular preparation was effective in preventing colds and flus. So in summary, we've looked at colds and flus are different organisms. There are over 200 when it comes to colds. There are 3 main types when it comes to flus. So we are looking at a variety of different conditions with a fairly similar group of symptoms. And we see that there are some herbs that can have some benefit, at least with symptoms or reduction in time. And there are some homeopathic remedies that may have some benefit there as well. But there's really nothing that quite cures the common cold and flu. All right, thank you very much.